How is seronegative RA finally diagnosed? Imagine trying to solve a puzzle where some of the pieces are missing. That's often what diagnosing seronegative rheumatoid arthritis feels like. And like other types, it doesn't show the usual blood markers, so doctors have to look at the bigger picture. The process starts with a detailed clinical assessment. A rheumatologist will ask about your symptoms, especially if you have symmetrical joint pain and swelling. They'll check for stiffness that lasts more than an hour in the morning, which is common in rheumatoid arthritis. They'll also look for signs of inflammation like warmth around the joints, and may note fatigue or other symptoms like dry eyes or redness that can suggest inflammation outside the joints. Next, blood tests are done, but here's the key. In seronegative rheumatoid arthritis, tests for rheumatoid factor and anticyclic citrullinated peptide antibodies are usually negative. That's why it's called seronegative. Instead, doctors look for signs of inflammation through markers like erythrocyte sedimentation rate and C-reactive protein. Elevated levels suggest active inflammation but aren't specific to rheumatoid arthritis. These tests help rule out other causes of joint pain and inflammation. Imaging studies are also crucial. X-rays, ultrasounds, or MRIs can reveal joint inflammation, synovitis, and early damage like bone erosions or cartilage loss. These findings support the diagnosis, especially when blood tests don't give clear answers. Imaging can also help distinguish rheumatoid arthritis from other conditions that cause joint problems. Since many diseases can mimic seronegative rheumatoid arthritis, doctors work to exclude other conditions. They consider diseases like psoriatic arthritis, ankylosing spondylitis, gout, lupus, and reactive arthritis. This involves a thorough history, physical exams, and sometimes additional tests tailored to rule out these other causes. Even with all this, the diagnosis can sometimes be uncertain. The American College of Rheumatology and European League Against Rheumatism have classification criteria for rheumatoid arthritis, but these are mainly designed for seropositive cases. For seronegative RA, diagnosis relies more on clinical judgment, imaging results, and inflammatory markers. Often, a team approach involving rheumatologists and other specialists helps clarify the picture when symptoms are unusual or unclear. Finally, the diagnosis can be supported by how well the patient responds to treatment. If symptoms improve with disease-modifying antirheumatic drugs, it adds confidence to the diagnosis. But it's important to remember that each person's experience is unique, and ongoing monitoring is essential. In summary, diagnosing seronegative rheumatoid arthritis involves piecing together clinical signs, negative blood tests for rheumatoid factor and anti-CCP, evidence of joint inflammation and damage seen on imaging, elevated inflammatory markers, and ruling out other diseases. Because it lacks the typical blood markers, it can be tricky, so a careful, ongoing evaluation by a healthcare professional is key to confirming the diagnosis and starting appropriate treatment. Always consult with a rheumatologist for personalized advice and management.